announcement builds on a historic funding package of $198.6 billion over the next 10 years that we have put forward to improve healthcare services for Canadians, to reduce surgical backlogs, to support healthcare workers, and to improve integrated mental health services. Access to mental health support is vital for those who are new to Canada, and this is even more important when it comes to our youth. I'm extremely confident that the funding announced today will help promote resiliency in our communities in the region of Peel and will help support those whose mental health has been most impacted by this pandemic. Today's announcement is yet another step in the right direction when it comes to mental health care in Canada. Our government will continue to support culturally focused and trauma-informed mental health programs for all Canadians, including newcomers to Canada and their families. Thank you. Merci.
And thank you so much, Minister Khera, for your ongoing support of the community, of the organization, and of so many organizations that support seniors across the country. Today is a really good day. My name is Gurpreet Malhotra, and I am privileged to be the CEO of Indus Community Services. This agency started at this location 38 years ago. As it's always focused on the needs of multicultural newcomers. It is focused on the needs of South Asian seniors, and is also focused on providing communities with culturally informed and supportive family services. The just announced Boost Wellness Project, thank you, will enable Indus to promote mental health awareness and provide much needed culturally appropriate mental health support to racialized youth who sometimes lack access to the needed supports in Peel region, which we all know is greatly underserved. According to the latest census, Peel South Asian communities now number over 537,000 people. Those hardworking, tax-paying residents represent a group that is about the size of the city of Hamilton, or twice the size of the city of Windsor. It's also more than all the South Asians living in British Columbia. You can tell I like looking at the census. That is a lot of people who rely on the services that our amazing staff are always focused on bringing to them. During the first 2 years of COVID, this region was probably the most locked down jurisdiction in North America. It was only after our local agencies worked together that we unlocked the potential of culturally appropriate supports.
Good morning, Minister. Prabnoor from Parvasi Media Group. I think it's phenomenal that we are finally acknowledging the deteriorating mental health of the students, of youth and international students. But I also feel that it's important that we echo upon the reason for the degrading mental health, be it inflation, interest rates, their inability to pay grocery for their rents. These students, they came to this country with so much hope, and they're contributing so much to the Canadian economy. How is Canada planning to support them back?
Thank you for that very important question. Let me just say, international students play a huge role in our Canadian society in terms of the labor shortages that they do fill in our communities. You know, they leave behind their families, their loved ones, and that is why, I mean, you know, when you talk about this pandemic, I think there's many different communities that have been impacted, but we saw here in the region of Peel was hugely impacted by this pandemic. But when you look at the people that were really impacted within the region of Peel are people that has been disproportionately impacted, whether it is international students, newcomers that have been coming into this country, or people that have language barriers that we've seen in our communities. That is why, you know, we made sure, you know, in the last few budgets, we had $100 million that we put forward to support mental health for those communities that have been disproportionately affected. And I'm very happy to say that $1 million of that will be supported right here in our community, in this community services, which I know, you know, for over 30 years, the tremendous amount of work that they have been doing in resettling of newcomers, of refugees, and helping international students navigate the system. We know and you know, as Gurpreet mentioned, how the impact of that will be in our communities. This is a long time coming, but I can tell you, as a federal government, we have been there, and we're going to continue to be there. As you may know, just last month, we announced $198.6 billion of agreements agreements with provinces and territories for the next over the next 10 years to make sure we're providing support when it comes to our healthcare. And mental health is part of that, making sure that is addressed at the primary care level, regardless of where people are, and making sure that they get timely access to those services. So we've been there on the table, and we're going to continue to make sure communities like here in our region of Peel are supported.
Like you said, that there are millions and billions of dollars of investments being made. But what eventually happens is that it doesn't get across to the students. The students, they're not informed about these investments, or if there's any support services that they can go to in the need of hour. We know that in this era of mobile phones, laptops, the virtual era, it turns difficult for the students, for the people who are already struggling with mental health, to come out and talk to somebody in real life. So are we providing them the right motivation and information of the same?
Very important question, and I think that is exactly why services like Indus Community Services are well placed to do that work. I was just having a conversation with Peter and Gurpreet earlier today about just, when it comes about the numbers that we talked about, but it really comes down to the person that's coming through the door and the number of people that the amazing staff member at Indus Community Services, and there are many different organizations throughout the region of Peel that provide this tremendous support, because there are services available, as you mentioned, but what happens is people don't know where to go. And I think a lot of the work I know has been done also with different colleges and universities, but it really trickles down to the people on the ground, and that's why I really want to give a huge shout out to Indus Community Services. I know I think it was almost like during the start of the pandemic when Gurpreet and I had a meeting about just the challenges of, with the high lockdowns that we had, the impact that it was having on, newcomers, but also international students. And we looked at what are some different ways that we can help those that are falling through the crack. And I'm very happy to say that we were able to do that by the $100 million that I mentioned that we put aside, particularly for those communities like ours and others that had been disproportionately impacted, that fall through the cracks, to make sure we look at and how we support those members of our community. And today is a good way of how we're seeing how that money has been is going to make sure those young people, particularly those racialized young members of our communities, international students, refugees, get the support that they need.
We have Minister of Seniors Kamal Khera with us, who have just made a phenomenal announcement revolving around the mental health of the youngsters, newcomers, and international students here in Canada. Minister, why don't you give us a little bit more information about this?
Absolutely. First and foremost, thank you so much to all the viewers. Sat Sri Akal, Namaste, Adab. I am Kamal Khera, proud Member of Parliament for the beautiful riding of Brampton West and Canada's Minister of Seniors. And I'm so pleased to be here in Mississauga with my good friend Peter Fonseca, Member of Parliament for Mississauga East Cookville. As you know, in budget 2021, our government put aside $100 million to support those communities and those groups that have been disproportionately hit by this pandemic, particularly when it comes to their mental health. We know just how challenging this pandemic was for our community in the region of Peel, and we're seeing the impact of mental health right here in our community, particularly when it comes to newcomers, when it comes to young people in our community, when it comes to international students. So I'm very happy to say that part of that, we are investing $1 million in this community services to make sure youngsters, as you mentioned, in our communities, those racialized groups, those international students that need that mental health support, get the supports that they need on the ground when they need it, because that timely access is extremely important. We know this is a group that was disproportionately hit hard. It have fallen through the cracks. We've seen some tragedies, of course, in our community, as you know, and this is really going to make a huge impact. I want to say thanks to Indus Community Services, because, they have a footprint throughout the region of Peel, and they provide tremendous support to people on the ground, and they have those good community relationships, and I know it's going to have a huge impact in the lives of so many.
I have with me the CEO of Indus Community Services, Gurpreet Malhotra. So thank you for talking with us today.
It's wonderful to have you here with us.
We talked about mental health and billions of dollars of investments being made towards it. But we still see that there's a lot of stigma revolving in our society. People refrain from coming out and talking about mental health. They're often given advices of going out, working out, praying more. What is your message to the students who want to come out and speak their struggles but are finding escapism in different ways?
So Part of that is what the new grant, the Boost Wellness Program, will help address, and that is the idea that our communities need to understand more about what mental health is, that mental health is health, that mental health is not something that can be easily dealt with and dismissed as just a temporary mood or a temporary situation. This is something that our communities need to learn more about how it impacts ourselves, how it impacts our young people, and how it impacts our families. And so what we aim to do with the Boost Wellness Program is to do public education and increase awareness around the different elements of mental health. Far too often people are told that if you feel sad, just be happy, and that would be the fix. And that doesn't recognize the enormous challenges that a newcomer faces, the enormous challenges that a young person born and raised here that happens to be a racialized background may face as they come across barriers or face systemic discrimination. And of course, the international students and refugee youth who are invited here, that are here to try to build a better life for themselves, but then face challenge after challenge after challenge, many of whom are unnecessarily generated and put far too much pressure on these young people. So the aim of this program at Boost Wellness is to do the best we can to raise these issues, have people explore them, talk about them, learn about them, both the young person and the friends and family around that young person. So in both ways that we can be a support to our large youth population.
You mentioned about raising awareness. So how exactly are you planning to raise awareness about mental health?
So we're looking at continuing to partner with the media to be able to bring that information to the communities, as well as our own, with 7 locations and with over 140 staff, the organization is well placed in Peel and Mississauga, Brampton, and Oakville to be able to reach young people and support those young people, connect to them. We also are, with 38 years or so experience reaching into communities, have a good and strong reputation for being able to provide support and assistance. That's settlement, that's family counseling, that's employment support, that's also support for seniors and others, so that there's many mechanisms that we can go back out to the community and then back to the people who would be looking for support and service.
Yeah.